So intermittent fasting, and Ramadan is just over. I don't know if you're familiar with Ramadan, but the Islamic faith people, they fast during Ramadan. They eat like one or maybe 1.5 meals a day, and they only eat like after sunset and before sunrise. Typically, they'll eat like a 1 meal a day dinner. And they, not only that, but they try not to like just gorge and stuff themselves on food. Like they're actually trying to cut back. And there's a long history with their particular fast. Like there's been a lot of research, and I'm going to talk about that, like the effects on the body. So intermittent fasting, we know what fasting is. Hopefully it's like going without food, and it's been talked about like in the Bible. It's been talked about in all the like sacred texts. It has a spiritual, mental, emotional, spiritual connection. Fasting does, depending on what you believe, like, there have been like prophets and Buddha and all these different people like that fasted for days and days and to get enlightenment. Fasting is beneficial for a lot of things, like, and it involves setting the intake of foods and calorie-containing drinks to a particular period of time. And some people will drink liquids on fasting that are non-caloric, like black coffee, like green tea, just plain without any sweeteners in it. Some people will do just a water fast. There's what they call a dry fast, in which people don't drink anything or eat anything, which is more drastic. You can only go for so many days without water. So that one is limited. But if you're doing a water fast, in the literature, they say that people can go for 40 days on just water. Most times I recommend that if someone is interested in doing that they get supervision or, get their doctor's input about whether the doctor thinks they're safe to do that. When you do fast, if you're on medications, most times people have to stop their medications after so many days because blood pressure is going to drop, blood sugar is going to drop, the mitochondria in the cells start working better. People may lose weight, they may lose fat. There's been linked benefits in cancer with chemotherapy. There have been studies showing that when people are getting certain types of chemotherapy, if they fast the day before they get the chemotherapy, typically the chemotherapy works better and they have less side effects. And then with Alzheimer patients, they've seen improvements. And that's because with Alzheimer's patients, we know that part of the problem is like reactivity to foods or sensitivity to foods that's contributing to inflammation in the brain. I skipped. Go back here. Okay, so some of the cons of fasting, it might go against your intuition. Like, you may want to eat, you may feel hungry. The side effects, sometimes people get cranky when they haven't eaten. So that's something to consider. That crankiness and irritability usually dies down after a couple of days. And then we have the intermittent fasting types. And this comes into play, especially when I'm talking to perimenopausal women that are having weight loss resistance. What I typically see is that they're fasting too much and fasting too long, and then their bodies go into stress mode. So with perimenopausal fasting, Usually we recommend that the fasting is varied from day to day, and not the same length of time every day and not too long. Um, but anyways, 16-8 means that the person is probably eating for 8 hours and then fasting for 16. And fasting is not as hard as some people say, because like if you stop eating after dinner, it's pretty easy to fast until the morning, which is like for most people, they should be finished eating dinner at 7 or 8. And then if you wake up and don't eat breakfast until 7 or 8, that's a 12-hour fast right there, which is actually pretty good. And then like if you can make it until lunchtime by just, drinking coffee or water, that's a 16-hour. There you go. It's not that hard. And they found that there's benefits of the intermittent fasting. So you could fast like on a weekend day and then just eat regularly other days, or you could do these like a 16-8 where you're eating every day, but then you're extending the time between meals. So, there's a big variety. I talked about the 1 meal a day, that's the OMAD, which is very common, and many religions use this during their feast days. Fasting mimicking. So there's a kit called Prolon, Prolon, that I have available. I think it's available on my website store, but it's available, and it's what we call fasting mimicking. And what it is the meals that are in there are all pre-measured calories. It's like 500 and 600 calories a day. So it's mimicking, fasting most of the day. And they've done research and it shows like if you do one of these, like eating very low calories for short term, it looks to the body just like you're not consuming anything for the same amount of time. So you still get the benefits without, starving. And this is the research that I wanted to mention that I didn't mention before. So they did a study looking at, I spoke about the Islamic faith participants, and they saw an increase in the abundance of Archimacea, which is what they call a keystone member of the microbiome mix in our digestive system. And then Bacteroides fragilis is also a keystone member. And the thing about the keystone microbes that are in our digestive system is that they actually make antibiotics towards pathogens. So we want to like feed those microbes when we're eating like fibers. And then, but what they saw was in fasting that the numbers of these good bacteria actually increase. So, and this has been seen in more than one study. They've looked at people like with SIBO, with IBS, with diabetes, and they see changes in the microbiome that are positive when people fast. And that could be any kind of fasting that's beneficial. And as I talked about earlier, this has been going on for tens of thousands of years. We've been fasting. The sacred texts all talk about fasting. And a lot of people ask me, what's the minimum to see the benefit? When I talked about the intermittent fasting, you're still eating in an 8-hour window or a 10-hour window. You can still get benefit there. And actually, there have been quite a few studies showing benefit with diabetes with that type of fasting, with intermittent fasting. Another question that a lot of people ask is, why do people gain weight while fasting? Well, as I mentioned, in perimenopausal women, it could be that they're stressing the body too much, and that can cause the body to make more cortisol, and cortisol will cause weight gain. It'll also cause the blood sugar to go up. It sounds weird and counterintuitive, but But the body, what's happening is the body is being stressed because it's thinking that you're in starvation. And if the body thinks you're in starvation, then it's turning on the cortisol to try to make you go and find food, because cortisol will make you crave sugar, it'll make you crave carbohydrates, salt. So the body knows what it's doing. And then go back to that slide. Okay, and then sometimes I have people journal what they're eating. It's interesting because Dr. Sanza, one of my friends, and I recently have had a couple of cohorts of a weight loss program that we put together. It's a functional weight loss program. And I was just looking back on data just of the whole group. And it's interesting that overall, people are eating way too many processed carbohydrates. And sadly, these are people that have actually worked with functional medicine doctors before. So they just have these habits that they have not reconciled or resolved of eating, first of all, too many carbohydrates, and then too many processed carbohydrates, and not enough protein. So, and that's kind of a trend that we see with the standard American diet, that Americans enjoy like eating a lot of processed carbs to our detriment, unfortunately. And then, are you consuming too much caffeine? So the journaling helps you to kind of keep track of what you're eating. And then, like, as far as caffeine, that's another thing where journaling could help. A lot of times I've done intakes on people, or started with people who were drinking almost a case of like Coca-Cola a day, or Dr. Pepper, or Mountain Dew, or in the South, it's sweet tea, you know, just drinking like 8 glasses of sweet tea a day, or coffee. Like they'll say, oh, I just have 1 coffee. And then when you ask them how many ounces, it's actually like 64 ounces. Whew. Yeah. I don't know how people, you know, well, they're not sleeping. And, you know, they're saying that they're not sleeping, they have digestive issues and all kinds of things going on, but they never like think, oh, is it the caffeine that I'm consuming? So like we were talking about, are we eating the right foods? So most Americans are not eating the right foods. I was having this discussion this afternoon with a practitioner in Decatur, and we were talking about, you know, most Americans are not eating enough servings of vegetables. And when people do this fasting, that's a good opportunity to try to get in nutrient-dense food instead of eating junk. Like, try to eat nutrient-dense food, try to get the body used to it. So I talked about the sleep, you know, are we sleeping well? And that's another area where we see a lot of weight loss resistance. And I was amazed in this weight loss program that we have, that no one in the program was getting adequate sleep. And everyone was trying to lose weight. So you cannot lose weight, you cannot be healthy if you're not getting adequate sleep. Just the body's not going to function without adequate amounts of water and without adequate amounts of sleep. So we already talked about the gain weight question. Oh, and what happens differently in menopausal women? So menopausal women are having a seesaw up and down of the hormones is what's happening. And that up and down on the hormones is causing the cortisol to spike higher than it should be. And this up and down on the hormones in the States is mostly due to our lifestyle. Women in other countries don't have all these issues with hot flashes and the hormones going up and down that we have in the United States. This is menopausal symptoms is a disease of developed countries and technology, unfortunately. Studies showed that alternating days in women over 50 was effective for weight loss. And I talked about that earlier. So varying the length of the fasting helps with the people that are weight loss resistant or perimenopausal. Okay, so this was talking about another study. In this study, they looked at women who were estrogen dominant or had PCOS, and they found that they could benefit from fasting, and they had them optimized at a 4 to 6 hour eating window. That means that they were eating 4 to 6 hours a day, and the rest of the time they were fasting. And this is consistent with what we see in diabetics too. And in this condition of PCOS, they have insulin resistance as well as estrogen dominance. And so it helps to correct that situation. And actually, newer studies coming out this year were saying that they're actually able to